Okay, friends, now let us talk about one more important 5 marker question in the chemotherapy, that is sulfonamides. Sulfonamide. First thing is sulfonamide kya hai? Like what is it? It is the first effective antimicrobial agent. Antimicrobial agents are the drugs which are given against the microbes. Microbes includes bacteria, fungus, virus. It might be any microbe ever exist ever. Then it is the first effective antimicrobial agent used in treatment of bacterial infection in humans. Sulfonamides is basically effective in bacterial treatment. So let us see the classification in sulfonamides. In sulfonamides, there are three types. Like some sulfonamides are specially systemic acting agents. Some sulfonamides are specially local acting agents, and others like sulfasalazine, it act both locally and systemically. So among the systemic acting agents, we have three types, that is short acting, intermediate acting, long acting. Short acting include sulfadiazine, intermediate acting include sulfamethoxazole, and long acting include sulfadoxine. Then local acting agents include sulfacetamide, silver sulfadiazine, mefenide. Let us see how this sulfonamides has its mechanism of action or how does it acts. Basically, PABA, which is known as the para-aminobenzoic acid, it is a precursor of folic acid. This PABA is very essential for the growth and multiplication of bacteria. But what happens, these sulfonamides, it is structurally similar to PABA. Means PABA and sulfonamides are like twins. They competitively inhibit folate synthase enzyme and prevent the formation of folic acid, thereby producing bacteriostatic effect. We know that sulfonamides is a bacteriostatic agent. This bacteriostatic action can be done by preventing the formation of folic acid, because folic acid requires PABA, but this sulfonamides is a competitive inhibitor of PABA. This is what they have given. Like para-aminobenzoic acid causes folate by the help of folate synthetase. Para-aminobenzoic acid by the help of folate synthetase causes dihydrofolic acid. Then dihydrofolic acid with the help of folate reductase causes tetrahydrofolic acid. Tetrahydrofolic acid is essential for the bacterial growth. But the thing, in the first step itself, these sulfonamides reacts with folate synthesis instead of this para-aminobenzoic acid, and this inhibits the formation of tetrahydrofolic acid. This is what happens. Even though this happens, the bacteria, they are also smartest guys, as it is said, survival of the fittest. This bacteria forms some resistance against these sulfonamides. Let us see how does it act. This resistance might be due to decreased affinity to the folate synthesis of the drug, or efflux of the drug by bacteria, or development of alternate metabolic pathway. See, mutation. There is a wonder called mutation. This bacteria undergoes mutation very fastly. So the bacteria are clever enough to create an alternate pathway instead of this pathway. This is how the bacterial resistance to sulfonamides develops. Then we'll study about the pharmacokinetics. Pharmacokinetics states all systemic active sulfonamides are well absorbed from the gut. So, since it is absorbed from the gut, it is usually taken orally. And the these sulfonamides, they are carried by the plasma proteins, especially albumin. Albumin is produced in liver. Sulfonamides, since albumins moves everywhere, the sulfonamides can move to all over the body, including CSF. And also this sulfonamide has a special power. It crosses the placental barrier and reaches the fetal circulation. And one thing to be noted is they are metabolized in liver, mainly by acetylation. The acetylated products have no antibacterial activity but retain the toxic potential of the parent compound. Sulfonamides are excreted partly unchained and partly metabolic products. So sulfonamides वो क्या है, वो liver में ना they get metabolized, like it is excreted as partly unchanged and partly metabolic product. तो लीवर में मेटाबॉलिज्म होता है तो ऑब्वियसली एडवर्स इफेक्ट होगा ही. द acetylated products are purely soluble in acidic urine. यूरिन का मतलब this urine has a acidic pH, so these are poorly soluble in acids. So it is to be noted that while taking the sulfonamides, we need to take plenty of water and alkalizing the urine. Also, these sulfonamides might cause hypersensitivity reactions like skin rashes, itching, fever, exfoliative dermatitis. The most well-known side effect of this sulfonamide is Stevens-Johnson syndrome, SJ syndrome, that is Stevens-Johnson syndrome. Okay. The most severe type of hypersensitivity reaction. It causes fever, erythema, and ulceration of the mucous membranes. In patients with glucose 6-phosphate dehydrogenase deficiency, that is GPD, glucose 6-phosphate deficiency, sulfonamides may cause hemolytic anemia. It rarely, since the acetylation takes place in liver, rarely hepatitis may cause and suppression of bone marrow basic mass. Sulfonamides, since it crosses the placental barrier, it may enter the basal ganglia, resulting into kernicterus. Okay, let us talk about drug interaction. Sulfonamides potentiate the effect of phenytoin, methotrexate, and oral anticoagulants or oral hypoglycemic agents by inhibiting their metabolism and displacing from the plasma protein binding sites. See, and these sulfonamides potentiate means this increases the efficiency of all these drugs. So therapeutic uses, sulfadioxine. Sulfadioxine, as we know, it is long acting sulfonamide, and pyrimethamine. They are used in the combination to form Plasmodium falciparum malaria. To treat malaria, sulfadoxine and pyrimethamine is used. Similarly, sulfadiazine and pyrimethamine is used to treat toxoplasmosis. Nocardiosis. For the treatment of nocarditis, sulfamethoxazole is used with the combination of trimethoprim. Then sulfamethoxazole in combination with trimethoprim. Initially, this sulfamethoxazole can be used for treatment of Zerovaci infection also, and also it can be used for the treatment of nocardiosis. Sometimes sodium salt of sulfacetamide can be used for treatment of ophthalmic infections. Sulfadiazine and mafenide, these are tropical sulfonamides. They are used for treatment of burn wound. Since there might be the chances of growth of bacteria, they can be used there. Sulfasalazine, this sulfasalazine is like double acting. It acts both systemically and tropically, so it can be used for inflammatory bowel disease and rheumatoid arthritis. Double acting, double diseases. IBD, rheumatoid arthritis. Rheumatic fever, sulfadiazine can also be used for the prophylaxis of fever, rheumatic fever. Okay, let's meet in the next video. Thank you.